Hello, good afternoon, good morning, good evening. Hello, Dr. Catherine.
Hello, how are you?
I'm fine, thank you. So I'm your moderator for this session. So we'd like you just to explain to us about what you guys are doing down there and the journey of sickle cell in Zambia. So we will let you do your presentation. Then later on, you can check on the chats for Q&A, and we ask our audience to continue sending their questions for you so that you can be able to answer them. Thank you. Go ahead.
Thank you very much. Thank you very much for the introduction. My name is Catherine Chunda. I'm a pediatrician coming from Zambia. I look after the pediatric hematology patient at the University Teaching Hospital, Children's Hospital. And I'm here to share with you our sickle cell journey in Zambia. To the organizers, I would like to take this opportunity to say thank you for this opportunity to make this presentation and just share with you what we're doing in Zambia. So I would just like to begin by sharing with you a profile of the country that I'm presenting on. So Zambia happens to be a landlocked country which shares borders with 8 countries, and I'm sure all these countries are part of the meeting that is taking place. We have a population of about 18.8 million people that we have to provide care to, and these are spaced over an area of over 750,000 kilometers square. The languages spoken in my country are various: English, Bantu, and we have over 70 dialects. I'm making this presentation from the capital city of Zambia, which is Lusaka. Our GPD capital is 19.70 as of the end of 2020, with a growth of about 3.5%. So in terms of background, sickle cell was first discovered in Zambia or reported in 1946. And this was actually reported in the East African Journal. 30 years later, Barclays reported the carrier rate within the country that was reported to increase from the south to the north, with the north reporting 20 to 30% carrier rate of sickle cell, and the south 6%. More recently, with some colleagues, we're able to report still that the carrier rate is quite high in rural northern Zambia, when we reported a prevalence of 15.5% of the carrier rate, and that of disease being 3.4%. In terms of healthcare delivery system, it is quite similar to what most other African countries have. We have a first, second, and third level healthcare delivery system, with the first being at community level, and the third either being the central hospitals or the specialized hospitals. In terms of administration, the country is divided into provinces and districts, having 10 administrative provinces and 105 districts. And these are actually responsible for health management within the country. So at present, we have 8 third-level hospitals, 34 second-level hospitals, 99 first-level. We have over 1,500 health centers and close to 1,000 health posts. And all these are actually providing healthcare services to the 18.8 million people within the country. We have, as the largest hospital, the hospital where I'm domicile, which is the University Teaching Hospital. In terms of how these health care systems are delivered, at present, we still have what you'd call a free or user fee charge kind of health delivery system, where some services, especially imaging and certain blood tests, occasionally have to be paid for. The under 5 and over 65 are able to access free healthcare services. We do also have the social services, um, providing partial or total exemption for payment for some of the services for those that may not able to afford. More recently, in 2018, a bill was passed in Parliament which allowed in 2019 that we have the National Health Insurance Scheme introduced within the country. So this is compulsory. It is a program that is still rolling out. So we have two existing systems within which one can access finances to access health services within the country. The biggest hospital in the country, which is the University Teaching Hospital, is occasionally called tertiary, sometimes quaternary hospital, the largest in the country with a total bed capacity of over 2,000. It's a hospital with 5 hospitals within it, one of them being the children's. We also have women and newborn, the cancer, the eye, and the adult and emergency hospital. The hospital also is the site for our largest university in the country, which is the University of Zambia. So the hospital hosts the School of Medicine, School of Public Health, School of Health Sciences, School of Pharmacy, and School of Nursing. The capital, as I mentioned, is Lusaka, Zambia, with a population of slightly over 2 million people, and half of the population actually being children from the age of 15. Within this hospital, various clinical care services, specialized and general services are offered. Training as well as research is conducted. And we have all these specialized support services, amongst them being hematology and blood bank services. Over 40 years ago, the first hematology oncology department or unit at the time was actually introduced at this particular hospital, and since then has had the tradition of having an outpatient clinic once a week, has dedicated 24-hour inpatient care facility as well. This is a unit that has grown to now become a department which belongs to the Children's Hospital of the University Teaching Hospital. Initially had a bed capacity of less than 10 beds. Now we have 48 beds, and we see over 6,000 patients who are being cared for in a dedicated outpatient care clinic. This particular hospital, being the one with the largest cohort of patients, has in the last few years reported very high admission rates for sickle cell disease patients, with sickle cell being the second commonest in 2019 as the second commonest cause of admission in the emergency department, and also as a 5th or 6th common cause of seeking outpatient care services. In the last year, 2020, when we've had point of care screening for sickle cell, we've actually noted reporting high numbers, with sickle cell actually being either the commonest cause of admission or the common morbidity that patients will come with in the hospital. Alongside the University Teaching Hospital is another hospital situated in the northern part of the country called Arthur Davison Children's Hospital, which houses a sickle cell disease unit with a bed capacity of 6 and is currently taking care of over 1,000 children and adolescents since 2011, when this particular unit was established. So I'm sharing with you a summary of 2 of the largest children's hospitals in the country, with large cohorts of sickle cell disease patients that are being seen, and few of the services that we have available. So each of the unit at one time has a minimum 2 pediatricians looking after these patients, with 3 residents who are spread between the hematology and the oncology unit, 8 nurses actually taking care of these patients. Each one has a weekly outpatient clinic, a follow-up clinic. We're able to access emergency care services, blood transfusion services. We do not have bone marrow transplant services at the moment. We don't have an electronic data registry at the moment. We do have some networks that we are piggybacking on, patients-based, are quite many, but we also have some sort of a twinning program with the ARISE program. In terms of training, we are currently not offering specialized training in hematology, but have entered into partnership with some institutions that will be helping us train our young doctors to become hematologists or oncologists. We have a number of research activities that are taking place locally, especially within the trainings that are occurring for those that are training to become general pediatricians. And we do have a number of collaborations that we have with different countries that I will share with you later. So in 2015, with the leadership of the late Professor Chifumbe Chindu, we began to engage the Ministry of Health in talks to establish a national program for sickle cell disease. And the vision at the time of this program, and still is the vision now, is that we'd like to have Zambia, where persons living with sickle cell live a productive life and contribute to the development of the country. Our mission being that we would like to mitigate the impact of sickle cell disease on affected persons, their family, and the country. Between then and 2019, we had a number of disruptions in the talks that we had, in that we had several changes within the government, that continuity of the talks were not possible, and we only managed to resume in 2019. So at the time, these were the objectives that we set out in the initial concept note that we shared with the Minister of Health at the time, that the objectives that we wanted to set out to carry out in this particular program. So we set out to actually improve and standardize the diagnosis and management of sickle cell disease. And within this, we had a vision to introduce newborn screening for sickle cell disease, to standardize the diagnosis of the disease, to introduce routine screening for the disease using a point of care test, and to formulate and adopt national guidelines for clinical management of sickle cell disease. We also set out to establish a clinical and data management system, an electronic one, to educate the health workers and the public about the disease, to conduct research that was going to provide information that was going to guide policy and planning, and also client management. Within this top on the agenda, something we have not yet gotten to do was that we plan to actually establish the burden of sickle cell disease within the country. So in terms of milestones that have been achieved already, since that meeting that we had with Minister of Health in resuming the talks in 2019, we were able to assemble or formulate a national task force for sickle cell disease, which I'm currently chairing. In 2020, June, when we celebrated the World Sickle Cell Day last year, we're able to have our national guidelines launched within the country. In the same year, we're able to have hydroxyurea put on the essential drug list as a disease-modifying drug for sickle cell disease patient. And because this particular drug is on the essential drug list, our patients are able to access the drugs through the National Health Insurance Scheme. In the same year as well, we're able to introduce point of care testing using the sickle scan for patients that had that were being admitted. Within our guidelines is that every child under the age of 5 is supposed to actually be screened for sickle cell disease. And with the introduction of this point of care test, we're actually able to screen quite a number of children in our institution, so that we have begun to see the disease as one of the common comorbidities our patients are coming with, or one of the causes of the morbidity they're actually coming with. In the same year, 2020, in March, we're able to begin the first meeting to draft the National Strategic Plan. And this was with technical support that was offered by the Ministry of Health. We're able to get the Director of Planning and Budgeting from the Ministry of Health to actually offer technical support during this meeting. We also had representation from the World Health Organization as well as advocates within that meeting. And our plan is that we would like to complete this strategic plan for the country within this year, 2020, because 2021 also happens to be the year when the National Health Strategic Plan actually comes to an end. So when the next cycle begins, we are going to have the strategic plan for sickle cell launched as well within there. In 2021, just over a month ago, we're able to launch newborn screening for sickle cell disease within Zambia. This is a program that has now been adopted by the Ministry of Health as a national program. Is a program that is coming out of a consortium of newborn screening in Africa for sickle cell disease called CONSA, which is being sponsored by the American Society of Hematology. So this is a newborn screening and early therapeutic intervention program being carried out in 7 countries within Africa. It's also registering these babies that are being diagnosed in the newborn screening program electronically as well. So these are some of the posters that we were able to showcase when the launch was happening. The one that you see at the bottom was from the Ministry of Health, whilst the other one at the top was actually from the advocates group. On both sides is the group of the first 50 people that have actually been trained in the management of sickle cell disease in the country. And that is the first that this particular activity is happening. So in terms of collaboration, you can see that we have quite a number of sickle cell advocate groups within the country. These are just a few of the ones that are there. I've highlighted here 6. We are currently working towards them having an umbrella organization under which they can work. Throughout all the work that we have partnered with them as a task force, as we've been drafting the strategic plan, as we have been drafting the guidelines for the country. And at present, we're actually even working on a work and school policy document that we are working on with the advocates. Aside from these activities, the advocates have also assisted in community patient and parent awareness about the disease. This has been done through radio, through TV, through social media, through face-to-face meetings, including get-together events that they do organize. The advocates have also been in the forefront of celebrating the World Sickle Cell Day and also the Awareness Month. They are currently actually making arrangements for this particular activity, which will be happening in a few weeks from now. They've also played a role as interface or ones that have actually introduced the task force to some of the potential collaborators. For example, they've introduced us to Novartis, who we have begun discussions with to see how they can make hydroxyurea available within the country. We have one particular organization which is offering free hydroxyurea to patients from vulnerable families, and at present is giving this hydroxyurea to about 30 or 40 families that among the children that we're actually following up. They've also managed to sponsor physician, parent, patient conferences or workshop. First meeting that we held to draft the strategic plan, the initial draft, was actually sponsored by one of the advocate groups. Other collaborators include World Health Organization, who have been our partners in launching the newborn screening program. They actually took over all the finances that went with the launch of that particular program. And now we're working together with them towards disseminating the guidelines for sickle cell disease that we have drafted throughout the country. The American Society of Hematology are the sponsors of the CONSA network, the program that introduces newborn screening and early intervention and registration of sickle cell disease in these different African countries. This is being done as a demonstration to the Ministry of Health in these countries that this is something that is possible to introduce within the countries. And this, of course, is being done with that Consortium on Newborn Screening in Africa for Sickle Cell Disease, which is CONSA in short, and comprises, as I've been mentioning, about 7 to 8 African countries. We have Guy's and St. Thomas National Health Services Foundation, which is the organization together with King Global Health Partnership and the ARISE program that has partnered with the two big institutions that look after children to introduce newborn screening through availing an isoelectric focusing machine, which we are currently using to screen the children. We are also part of the Sickle Cell Disease Ontology Network. We have partnered in doing short trainings through the Sickle in Africa network and also through Sparkle, and are currently also in discussion with the Inherent group to see what research activities we can carry out with the different countries that are involved in that network. So you could all appreciate one of the things that are asked at the end of the, the big title of this meeting is what next? I think we all recognize that until we have official recognition of the fact that this disease is an important cause of child morbidity and mortality in many African countries, it will be very difficult to move any agenda. And with this, we actually need concerted efforts from our Ministry of Health or our governments to back up the policies that we're coming with formulating national policies or formulating guidelines and making sure that the programs that we come up for sickle cell disease are actually institutionalized. Within these programs, we need widespread screening for sickle cell disease, which includes newborn screening. As you can see, we're doing demonstrations within these African countries just to show that this is something that can happen. Alongside with the screening, there's need to do health education of health workers, communities, patients, and caregivers as well. We need to put in place early preventive and therapeutic for example, guidelines right from the scratch, because we have a number of countries that already have these and we can adopt from them. We need to also explore some of the local public healthcare networks that we have in our country, again, to avoid reinventing the wheel. We can use the EPI program that most African countries have. We can use the early infant diagnosis of HIV program to integrate some of the programs such as screening and education. We can leverage on the already existing frameworks or services within those particular units and be able to introduce these services within our country. We do need surveillance and research that will help us objectively document the burden of the disease. I think for a long time, most African countries have struggled to prove to their struggling Ministry of Health that this is a disease that requires equal attention as they are giving to the infectious diseases. So we need to do surveillance and actually to do research, following which we will be able to document the milestones that we attain, having come from a point where we know where, and of course we need to be practicing things that we have researched within the countries that we are working. This, I end my talk. Thank you very much.